All right, ladies and gentlemen, welcome to the program. So, as I mentioned, for this webinar, attendees will be in a listen-only mode. If you need technical assistance, please submit your request under the Tech tab in the window in the top right-hand corner of your computer screen. If you wish to submit a question during the presentation, please use the Q&A window in the top right-hand corner of your computer screen. Presenters will do their best to answer your questions. However, due to time constraints, not all questions may be addressed during this webinar. In a moment, we're going to turn the presentation over to our moderator to begin things and kick it off with introductions. But we're going to start with this short video clip. Enjoy.
So I realized that's what marketing people are good at. They can take statistics and make them say whatever they want. They can make their message fit a statistic. So I figured if they could do it, I'm an engineer, I'm a prototype guy, so I worked up some slides to prove that anybody can do that, if we can go back to my slides. So here you go. I looked at some statistics and I found these on the internet, and I'm just gonna make it say what I choose to make it say. So they polled 1,000 people. Turns out 3 out of 1,000 people polled said they've choked on a potato chip. Not died, just and they were fine. Same 1,000 people, only 1 in 1,000 said they've choked on a pretzel. So if you were in marketing, you could say, pretzels, the snack that's 3 times safer than the potato chip. Absolutely true statements. Suddenly people would be running from that dangerous potato chip. Kids are killed by them every day. Run! Another quick example. Your chances of getting Alzheimer's by age 85 are 1 in 10. Kind of scary, actually. The average smoker lives to be age 66. So if you were in marketing at a cigarette company, you could say, smoking lowers your chance of getting Alzheimer's. Right? Absolutely correct statement. I can see the commercials now. Go ahead, light up. You won't be getting Alzheimer's. We hope to stamp it out in the next generation. Go ahead, 2 a day. Now, you may ask, why does this matter? And here's why it matters. People get scared all the time. They don't realize that 5 or 10 times a really small number is still a very small number and not very likely, but they freak out. My mom is the best at this. She always hears these things, and she's afraid to use anything. And I worked up this example to prove to her that it's irrational to be scared, and it ended up scaring her anyway. So here you go. 1 out of 1,677,345 people will get mauled by a bear. Really not very likely. Could be a bear right there, probably not gonna maul me. Really. Statistically, it would just keep walking by. Even if you're a bear, only 1 out of 335,469 bears are involved in the mauling of a human. But it turns out 2 out of 10 people have never seen a bear. Therefore, if you've seen a bear, you're 10 times more likely to get mauled by one. My mom's conclusion, don't look at bears. Reasonable. I never went to a zoo till I was 26 years old. But then again, I've never been attacked by a bear either. Maybe Mom was smarter than I give her credit for.
All right, so we're going to go ahead and get things kicked off now. I would like to begin by introducing our moderator for today's event, Jean Lefebvre. So, Jean, it is all yours.
Great. Thank you so much. I hope everybody enjoyed that video. I'm sitting here laughing. It's pretty funny, and there were some extreme conclusions, of course, but it just sort of shows you there is some truth in how data is presented. So today's webinar will focus on what data really matters, especially in terms of how clients can help control their health plan spend. I'd like to thank today's sponsors for our webinar. So we have sponsorship of this program by Zealous, who is one of our partners in service. Thank you very much. And then also thank you to our 2021 Easy Webinar Series sponsors, Accurate Solutions and Nationwide Insurance. So first up, we have Eric Lamotte, who is our Chief Risk Officer, and Eric's been with Health Easy for 14 years. He has a wealth of knowledge in terms of how to manage the risk arena for our clients, and he oversees our analytics department. So he's always looking at things and trying to find solutions for our clients. And then after that, we'll hear from Julia McKay, who is our manager of analytics, and she'll be going through some of the more meaningful reports that our clients see. And as part of that, there is a focus on chronic conditions and diabetes in particular, which most groups have some members with that condition. And we'll get into more of the details and bring in Rebecca Mason, who is our program manager for Live Easy, our well-being suite of services. And Rebecca will get into how the reports actually give us actionable items to help get diabetes under control. So with that, I will turn it over to Eric Lamotte. Thank you.
Thank you, Jeannie, and thank you for everyone who's listening today. We are very happy and honored that you could join us today, and we hope that you find value in this webinar. Measure What Matters. Measure What Matters is a perfect title for this webinar because it's exactly what we've done. We've looked at what is meaningful to employers and their trusted advisors, as well as what impacts the plan. That information has been condensed into HealthEasy's proprietary package that is simple, clean, actionable, and in an easy-to-absorb format. Today, we will review at a high level selected reports. We have a complete extensive library of reports available to assist you. HealthEasy's model is one of transparency. So if an employer or an advisor wants to see further into the details behind the reports, HealthEasy is happy to provide a complete view of the data. With that said, let's dive into the reports. In the spirit of this webinar, we'll leave you with 5 measurements that matter that impact both the plan and its participants. We start with a great visual showing whether overall plan costs are trending up or down and which cost categories are driving that increase or decrease. The idea of this report is to keep it very high level and simple, quick, easy view. The sample data we are displaying is an employer with 350 employees. You can visually see that medical claims have been the largest area leading to an overall decrease by the group. An instance where this report can be actionable is if there's a change in historical norms, either in medical or pharmacy spend. For example, if there was an increase in RX spend from $100 per employee per month to $150, it would be an area to focus on, and there may be strategies that could address the change in pharmacy spend. Next, for the people who like to see raw numbers, you can see on this page a clear breakdown of where the dollars have been spent monthly, annually, and on a per employee basis. Again, the takeaway on this page is what is the plan spending overall, and is that trending in the right direction? In this example, the per employee per month spend is decreasing overall by 6%, on an average of 6% year over year. And that increase is being driven primarily from medical claims, or that decrease. Next, we have one of my favorite pages in the package. When an employer moves from a fully insured model into a self-funded model, they're making a multi-year strategic decision. When making this impactful of a decision, you want to be able to go back and validate, did the results turn out as expected? Of course, there's many benefits to the self-funded model beyond bottom line cost. This sample savings report is from the same 350 life employers, the prior 2 slides, and this employer has been with HealthEasy for just over 10 years. These 2 graphs show a few things. One, in 9 out of the 10 years this employer has been with HealthEasy, the group has saved over $1,000 per employee per year over what they would have spent fully insured. 2, and if there's one key takeaway from my presentation, this is it. When you look at the savings over time, the savings per employee per year tend to increase over fully insured the longer they've been in this model. This is a common pattern that we see where employers see greater savings the longer they're in a self-funded model. Also, I'd point out on this page that in 2019 and 2020, the two most recent years, they were exceptionally good years, where the savings exceeded $3,000 per employee per year. These exceptionally good years in a self-funded model could come in year 2, year 5, or year 8. Similar to when you invest in the stock market, if you stay in long term, you see the biggest gains. After an adverse claims year, if you say, let's go back to fully insured, you missed out on the exceptionally good years. The final point I would make on this slide is that over the 10 years, this employer has saved over $5 million over fully insured, which is consistent with our experience as 80% of employers of all sizes save significantly in a self-funded model if they stick with it for at least 5 years. Changing gears to everyone on the phone who's a leader, works for an employer or an advisor, this may be the most important page in the package. Whatever plan costs are, if the plan is not working for members or members are dissatisfied from a service standpoint, the plan is not working well. That is why Health Easy has always been built on service and serving our members. The customer service report is a great indicator of the kind of service members are receiving. Health Easy is committed to keeping wait times when members call in to under 30 seconds. As many of you know, Health Easy has never believed in phone trees, so the wait time is how quickly members are connected to a live representative. Health Easy provides best-in-class service when it comes to member experience with our call center. The other key takeaway or actionable item from this report are potential areas of member education needed. If there's with all of the custom phone numbers that Health Easy is tracking, we're able to track at a group level why members are calling in. So if there's a category that members are calling in for or a reason members are calling in that seems more frequent than normal, we can dive into that with the employer or their advisor to determine if there's more education needed on a certain topic for members. And we can assist with that. Now we get into more detailed utilization data. The cost by plan type page provides quick answers to those who want to evaluate one plan's performance versus another. For this page, we had to use another sample group as the prior group we've been using in the sample data only had one plan in place. The particular employer we're using for this sample report had a goal of providing better benefits to employees without increasing plan costs. So they added a high value plan to their existing copay and HSA plans. The high value plan was set up to steer employees to providers that were high quality providers, but also good in terms of price. This report helps track if the plan is having the intended outcome it was set up to. As you can see on the report, the high value plan is running by far the lowest in terms of costs, where it's running at $184 per employee per month compared to $500 on the copay plan and $800 on the HSA plan. Also, the best risk members are participating in the high value plan. As you can see, the prospective risk score for the employees in each plan. An overall risk score of 1 is average risk. So if a group has a risk score over 1, it's above average risk, and below 1 is better than average risk. So the HSA and copay plans that were the existing plans have about average risk in the plan, and then the best risk employees have tended to take the high value plan. So again, this report validates that the action the employer took in this instance is having the desired outcome. The next page ties into the previous. It provides a simple, clear picture as to how much of the claims are being picked up by the plan versus the members. This page is included in our package as it's a question that frequently comes up when reviewing plan data with employers. One instance this question is raised is at renewal time each year, and it's helpful in ensuring premium contributions for employees are being allocated appropriately. One other comment on this page is it's a great example when looking at stats, to go back to the initial video, when looking at stats, putting them in context with all of the data in the package instead of just just the report you're looking at. When looking at this report, members are picking up 42% of the cost in the HSA or in the high value plan versus 24% of the cost in the HSA plan. So the reaction, sort of looking at that, is members are getting stuck with a lot of the bills in the high value plan. However, the total cost, as we looked at on the previous slide, in the high value plan is so much less than the other two plans that 42% of the cost in the high value plan may be a much better deal for members than 24% of the cost in the HSA plan. Plus, because of the way the plan was designed and steerage, a dollar spent in the high value plan for members goes much farther than a dollar spent in either of the other two plans. With that, I will hand it over to Julia for the next portion of the presentation. Julia, as Jeannie mentioned, is the manager of analytics at HealthEasy and quickly a rising star at HealthEasy, and she enjoys bringing clients actionable insights.
Great. Thank you, Eric, for those insightful reports. It's a pleasure to be with you here today to showcase our reporting capabilities and measuring what truly matters. What matters is continually changing, and different times require different focuses. As you can imagine, in 2020 and even into 2021, many Americans have felt the impact of the COVID-19 pandemic. That is why we created this COVID dashboard to highlight the cost of one of the most basic forms of preventing the spread, a COVID-19 test. Displayed here are the different types of tests, whether a nasal swab, saliva test, or antibody test, as well as the number of members that were diagnosed with a positive COVID result. We're also highlighting testing by place of service. As you can see here, office versus outpatient hospital or inpatient hospital, which may impact the price of the test. Overall, nationally, we saw a median cost of $148 per test. Half of tests priced between $100 and $200, and 1 in 5 tests priced above $300. In this example in particular, $76.50 is a pretty decent price considering the average cost was about $150. Those who may have been impacted the most during this pandemic are those diagnosed with a chronic condition. Members with chronic conditions like diabetes, asthma, obesity hold a higher risk to complications with the virus. On this chronic conditions report, we're just highlighting some of those top chronic conditions that we're seeing for members of a particular group. In this example, about 28% of members of the population having one or more chronic conditions, which is what we see pretty typical across the board. With members with chronic conditions and their higher risk with COVID complications, one of the things that we did here at HealthEasy was having our care management team reach out to these high-risk individuals and address any questions or concerns they might have and help in any possible way. One of those amazing care managers that were working directly with members, impacting their lives and helping them reach wellness goals that they never thought possible to achieve on their own, is with us here today. Rebecca Mason, the director of our Live Easy and Diabetes program, is here to tell us about some of the amazing work that she's been able to do by measuring what matters.
Thank you, Julia, and thank you to everyone for joining us today. Julia and Eric have done a fantastic job today highlighting that with the transparency and our proprietary reporting, we can really dig into this data and start moving the needle on healthcare costs. One of the biggest spends for healthcare is chronic conditions. HealthEasy has several programs in place to help capture these individuals and to try and stop these conditions from developing or getting worse, such as our on-site biometrics for early detection, for elevated labs, our care management and chronic care management team to educate and assist health plan members with managing their health. So there's metadata, group data, and anecdotal data when it comes to managing chronic conditions. Today, I would like to review with you the diabetic data, which uncontrolled can result in a medical storm. So starting with little education, leading to uncontrolled blood glucose, and potentially resulting in amputations and even death. From everything we're hearing, we know that diabetes rates are increasing, which is putting a strain on our healthcare system. And we can expect to see this getting worse if we do not provide education and resources to our employees and our plan members. So here is an example of some of the data that we look at. There will be variances in medications, labs, and readiness to change. And we assess how we can impact the quality of life, productivity, and compliance, thus leading to better outcomes and costs for the health plan and member. So here's a group that we've stepped in to provide a full suite of services. So we can see that this group had tremendous improvements in their A1C and control, but most importantly, we saw massive improvements in their quality of life. We had a member lose 100 pounds and prevented another member from a 20,000 plus hospital visit related to diabetic ketoacidosis, which could have resulted in coma or death. I'm currently working with a lady that has had diabetes for 20 plus years. When I first started working with her, her blood sugars were in the upward of 500 to 600 range. For those of you that are unfamiliar with diabetes, the recommended range after a meal is less than 180. After talking with her, I learned that she drinks a liter of Mountain Dew a day and was not taking certain medications due to prior approval needs. So we walked through barriers and habits, and I assisted with getting those needed documents to get her medications approved. She thankfully has since cut out all soda. Her blood sugars are now in the 180s to 200s. And while we do have a ways to go, her risk of severe complication has gone down significantly. She told me the other week that she had never received education on diabetes management, and her doctor had never told her where her blood sugar should be. He only kept on increasing and adding medications. Since seeing how quickly she has been able to improve, she continues to push herself daily on her eating habits, and now has established a goal of getting off of her insulin because she's no longer needing as much. We have countless stories like this, but as I've highlighted today, we provide the support and guidance to give employees a better life, improve productivity, but also save them and the health plan money. With early interventions and proper education, we can try to prevent high-cost medical concerns. But for those cases that are unavoidable, I will hand it back to Julia, who will review the plan utilization for the population that is dealing with the high-dollar chronic and acute conditions that our care management team is closely working with, and how this can impact plan spend.
All right. Thank you, Rebecca. Truly amazing work that you're doing here at Health Easy. With that, we'll just switch gears a little bit here to discuss this emergency room utilization dashboard. What we're summarizing here are emergency room visits for a group during a particular plan year. Up top, just summarizing the average allowed amount, plan versus member paid. Below, we're seeing the top ER visits by diagnosis. And then in the middle of the page, we're just monitoring these ER visits by severity. One of the points that we like to make here at Health Easy is how far education can go in terms of appropriate usage for the ER. So in terms of these minor to low severity visits, these are visits that potentially could have waited for urgent care or an office visit, and overall could have resulted in savings had members chosen to go there. We're also keeping an eye out for members that are what we like to call frequent flyers to the emergency room, members that are going 2, 3, 4+ times to the emergency room in a plan year, because they're using that as their first choice of service or primary care. So what we do here is if we are seeing members that are using the ER as their first choice, having our care management team reach out and making sure that they have a primary care doctor that they can go and see instead. In the emergency room, those nurses and doctors are looking for those emergent situations and looking for fast acting and quick results to resolve that situation. Whereas the primary care doctor can focus on real needs and concerns for a member and overall, provide long-term solutions into that member's condition. Overall, just stressing that the ER doesn't necessarily serve that quality care that we like our members to receive. So just, identifying where members would really benefit from that primary care doctor. Overall, that's not going to save just the plan money, but also the member money as well. Following that, we have an expense distribution report. A pretty simple report, but very important, just identifying members ranked by their total medical and pharmacy spend. As you can see, that top 1% of members in this population making up 30% of costs, followed by that 2 to 5%, which again is making up about 32% of costs. So just within this top 5% of members, we're seeing over 60% of costs, coming from these individuals. Which brings us to our large claimant report, where we're really identifying those higher dollar or higher risk individuals. And in this report, it is a dense report, but what we're highlighting here is the transparency and information that we're able to provide. This transparency and information is really crucial to making informed decisions how best to benefit the plan as well as the members, whether that's steering those members to high quality providers or more cost-effective places of service for their treatment. Our team here at Health Easy is always looking for better solutions for these higher dollar claimants. We like to provide this information as it's occurring, again, that transparency, so that we can, be actionable on these members' treatment. This is the same information that the reinsurers are going to get around the time of renewal. So really just providing this information with enough detail and color so that you're, just as aware of these serious cases that we're managing for you. With that, we will touch on the health plan dashboard. What we're summarizing here is the plan paid amount by service category on a PEPM basis, or per employee per month cost. So in blue, you can see the current or the reporting period that's of the most concern. And then we provide a comparison period so you can compare to prior plan years, as well as a benchmark that is specific to a group size and demographics. So in regards to comparing to prior plan years, this really accounts for any sort of fluctuation in enrollment, whether you're seeing a decrease in enrollment or maybe a big increase that's bringing on higher risk individuals to a plan. By comparing to that prior plan year, you can see, where are these maybe new high-risk individuals going in for their places of service? Can we steer them elsewhere? Finding the best strategies and solutions in terms of care for both the plan and for the member. And with that benchmark comparison, we can really take a look at how the plan is running. That really just provides a good basis of comparison for the plan. One of the largest ongoing concerns that we're seeing for most of our employers is pharmacy spend, in particular specialty drug spend. Again, this is a bit of a dense report, so I don't feel the need to read, all of these numbers in details, but if you just take a brief look at this list of drugs here, you may recognize a few of these drug names. Probably from the commercials that you've seen on TV. If you think about those commercials, everyone is happy in the sun or on the beach, having a great time, but I'm guessing they aren't really thinking about, maybe the huge list of side effects, or in particular, our big concern, the cost of the drug. So what we're doing with this report here is just highlighting the cost of those specialty drugs, as well as anti-arthritic spend and diabetes spend, which also tend to be higher dollar medications on a lot of our plans that we see. And with that, we can, by taking a look at these specific drugs, finding solutions in terms of the pharmacy spend, whether that is shopping different PBMs to find the best benefits towards a group's pharmacy costs, or looking into programs that may carve out certain specialty drugs entirely off the plan, which can obviously provide a lot of savings towards a group. Obviously, we assist in any sort of member transition if we were to carve out specialty drugs, making sure that there's little to no disruption on the way that they're filling and using their medications. But again, there's tons of different solutions that we can look at in terms of pharmacy spend, because just from group to group, every list of drugs is going to be different. So just taking that information and looking at what strategies we can provide to bring down those costs. It's been a real pleasure just giving a high level overview of some of these new reports that we are bringing to our Health Easy clients. Thank you again to Eric and Rebecca for touching on some of those insights towards their reports. Hoping that you can take away just 5 measures that matter, being overall trend per employee per month, member satisfaction, chronic disease management that can be impacted by lifestyle, large claimants, and transparency in regards to their treatment, and then specialty medications, measuring that and finding potential savings. And with that, I'll turn it back over to Jeannie.
Great. Thank you so much. That was great information from Eric, Julia, and Rebecca. And it's just an indication of, what reports really are meaningful. You can get huge, reams of reports with a lot of data, but, deciphering what it means and actually having actionable items is a whole nother thing. So we hope you saw some of the key takeaways that truly can impact health plan spend. So as a reminder, you can submit questions in the chat box, and we do have a few that I'd like to get into right now with our panelists. So the first one comes in from an advisor, and it says, with especially the report I think you showed on plan spend by each plan. So do clients change their plan designs during the middle of the year, or what sort of things can you do when you see, statistics that are probably not trending in the right manner, the right way?
Sure, I can take that. Yeah, and I hope during the presentation that people found a couple of things that sparked some thoughts in their head. And our vision at Health Easy is to transform the benefit packages of our customers and work with them and their advisor on that to provide their employees with really a more robust, better offering that works better. And to that point, the data that we collect throughout the year and report back is used throughout the year. A lot of times throughout the year, that's in the form of educating members, but also can be, putting it in action. An example of that is we recently were working with a larger client, and they were getting feedback from their employees that the insulin cost for diabetes was hard for members to afford, and some members were rationing it to an extent. So we dove into their data, and the amount that it would cost that employer to cover diabetes insulin at 100% was relatively small. So they made that change in the middle of their year, and they started covering insulin at 100%, and it had overwhelming popularity and positive feedback. Also, when it comes to steering members or looking at what providers we steer people to, a lot of those kind of actions are taken mid-year. Otherwise, benefit changes such as deductibles, copays, a lot of times do take place at renewal.
Great. Thank you, Eric. The next question here, I think, is probably for Rebecca. So you talked a lot about what happens with diabetics and the management of that. Are there other chronic conditions that show up in the reports that you have programs for?
Yes. So we do look at tobacco cessation and have a program for that. We do have a maternity management program called Boost Your Baby, and we'll soon be rolling out a hypertension and obesity program. So we're really excited about that. So stay tuned for more information.
Great, thank you. And one other question, I think this might be Julia, or Eric may want to chime in too. But one of our advisors has asked, you mentioned risk scores in one of your reports. So how are those calculated?
Good
Sure,
question.
I can jump in. Our analytics system uses Milliman data to, based off of claims data, to assign a risk score on an individual basis. And then that information is taken, and when looking at aggregate for a group or a plan or a division or a location of an employer, it can be split in many, many ways. Then we can average out those risk scores to come up with a population risk score in aggregate.
And are those risk scores then helpful with the renewals and negotiating renewals with the reinsurance carriers?
Yes, we have some of our select carriers, including Accurate and Nationwide, who sponsored this webinar, who also are believers in those risk scores. They understand them, they use them in their underwriting practices. So when we're able to provide that data to them, and a group has an improving risk score or prospective risk score better going forward than what it has been in the past, we're able to get some more favorable credit from an underwriting standpoint.
Great. I think that is it for our questions. If nobody has any other ones, again, thank you to everyone who attended today. We are part of the way through the year in our 2021 Easy Webinar Series. And if you don't have our brochure on all the webinars that we will be hosting this year, let us know and we will be sure to get that to you. We have a lot of topics that are coming up. In June, we have one on value-based care and what is known as bundled pricing with surgeries. In July, we have summer skin check, which is important. And one of our dermatology partners will be speaking on that. And then we'll get into more on stop loss, medical management services, what is really meaningful, and a host of topics throughout the year. So thank you to our presenters. Thank you to Zealous for sponsoring this particular webinar. And again, thank you to AccuRisk and Nationwide for sponsoring our series. We hope to see you soon. Thanks.
That concludes today's presentation. On behalf of the presenters and Health Easy, thank you so much for joining and have a great day.